Your health is a part of who you are, and at Aetna, we get that. We want to provide more than a health insurance experience. That means true commitment from paper cuts to major injuries. We're here. We believe in trusting relationships with our members. You'll get access to plans, programs, and tools that fit into your lifestyle and can help you reach your goals. Whatever your journey, we're here for you. Over the next 15 minutes or so, I'm going to show you how we're working with DC government to give you the benefits you need. So let's get started. Next slide. So what's new for 2023? For the CDHP plan, per IRS guidelines, the minimum annual deductible for 2023 will be $1,500 for an individual and $3,000 for a family. Minute Clinic benefit remains $0 copay for the PPO and HMO plans. For the CDHP, the cost share is $0 once the deductible has been met. For the walk-in clinic benefit, there's a $0 copay for PPO and HMO plans. And for the CDHP plan, it's going to be a $0 cost share once the deductible has been met. Preventative care remains covered at $0 cost share for all plans. Next slide. So we're going to talk about benefit plan options. Next slide. All plans include access to virtual care from highly qualified physicians and practitioners. It is there for people when they need it, and the care is private, convenient, and affordable. Whether it's from one of our network providers, telemedicine providers, a video visit through a Minute Clinic, or remote monitoring, we're expanding these ways to help people on their path to better health. Next slide. With your Aetna HMO health benefit plan, there's no guessing or tricky decisions. To get quality care and lower out-of-pocket costs, all you need to do is stay in network. Our medical plan allows for you to take charge of your health and benefits. You have freedom of choice, flexibility, and broad coverage with a national network. You're only going to pay a copay for services, and no referral is required to see a specialist. Next slide. Now let's talk about your in-network benefits. This medical plan covers preventative care services at 100% when using an in-network provider. There is no deductible to meet. You simply pay a copay for your medical services. This is just a sample of some of the benefits in the plan. Next slide. This chart represents the copays you will pay when you use an in-network pharmacy. Keep in mind, you may be able to save money by using the CVS Caremark mail order program. Next slide. With your Aetna PPO benefit, you have freedom of choice, flexibility, and broad coverage. Our plan provides coverage for in and out of network care, 100% coverage for in-network preventative services, and never requires a referral. Next slide. Now let's talk about your in-network benefits. This medical plan covers preventative care services at 100% when using an in-network provider. After that, there's a $750 individual deductible that you must meet. Essentially, you're going to pay for the first $750 of medical services you receive. Though, as you can see, some services are not subject to the deductible. You will never pay more than the out-of-pocket maximum in a calendar year. For an individual, that maximum is $1,500 and $3,000 for a family. This is just a sample of some of the benefits in the plan. Next slide. This chart represents the copays you will pay when you use an in-network pharmacy. Keep in mind, you may be able to save money by using the CVS Caremark mail order program. Next slide. You have a high deductible health plan or a CDHP. These type of plans help you better manage healthcare costs. As always, preventative costs from an in-network provider are covered at 100%. You're protected from catastrophic costs by the out of pocket maximum, and you never have to meet, or after you meet your out of pocket maximum, your plan pays 100%. Next slide. Now let's talk about your in network benefits in the CDHP plan. This medical plan covers preventative care services at 100% when using an in network provider. After that, there's a $1,500 individual deductible that you must meet. Essentially, you're going to pay for the first $1,500 of medical services you receive. After that, you will pay coinsurance for covered services. You will never pay more than the out of pocket maximum in a calendar year. For an individual, that maximum is $3,425 and $6,850 for a family. This is just a sample of some of the benefits in the plan. Next slide. Any prescriptions obtained will be subject to the deductible first. Once the deductible is met, the copay will kick in if you're using an in-network pharmacy. Again, you may be able to save money by using the CVS Caremark mail order service. Next slide. You can contribute to your HSA up to $3,850 for an individual and $7,750 for a family. You can contribute an extra $1,000 if you're over the age of 55. This tax-free fund helps you pay for out-of-pocket medical expenses. If you don't use all the money you set aside during the year, you can roll it over to the next year. Next slide. Sometimes things just happen. Your child develops flu symptoms after your primary care physician office has closed for the day. You step on a tack over the weekend. We get it, things happen. And when they do, you want to be able to access care at a price you can afford. That's why we're offering a perk, access to covered Minute Clinic services at no cost to you if you're enrolled in the HMO or PPO plan. If you're in the CDHP plan, there is no cost to you once your deductible has been met. Minute Clinic is a walk-in clinic inside select CVS pharmacy and Target stores and is the largest provider of retail healthcare in the United States, making it easier to access care in your neighborhood. Open 7 days a week, including evenings and weekends. You can walk in or schedule appointments online. And for even more convenience, you can pick up your prescriptions on site. Next slide. Personalized for you. Next slide. In 15 minutes or less, you can take the first step to improve your health by completing or updating your health risk assessment by logging on to your Aetna member website. In addition, if you complete your biometric screening, you can earn a $100 gift card. And once you complete or update your health risk assessment, you can earn a $50 gift card. We also have interactive online health coaching programs that can help you take simple steps to a healthier life. Employees who participate can learn how to manage pain, diabetes, and other chronic conditions. You can even earn a $25 gift card for completing one of these programs. Next slide. Attain is a program you have access to when enrolling in the medical plan. You can use your own Apple Watch or Fitbit. If you own an Apple Watch Series 1 or newer, or a Fitbit device, you can use Attain to earn up to $300 in gift cards over the course of 24 months. You can start redeeming points for gift cards to popular retailers like Amazon, Best Buy, Target, and Starbucks once you've earned at least 5,000 points, which equates to $5. Points also don't expire, so they roll over from month to month. Next slide. Your health, both physical and mental, is everything. Whether you're managing a chronic condition or dealing with complex health challenges, our nurses can help. If you're identified for care management, a nurse can help work with you to get a plan together, help you understand your benefit offerings, and answer your health related questions. With the Aetna One Care Management Program, you get access to one on one personalized nurse support for you and your family, group coaching support, cancer, maternity, and joint support systems through your Aetna member website, your 24-hour nurse line support. You can do provider searches. You can look at your personal health record, support programs, including hip and knee and end of life treatment. Aetna member website is there and the Aetna Health app. You have digital tools, educational videos, and so much more. Next slide. The Aetna maternity program is part of the plan and is no cost to you. By participating in this program, you'll learn more about what to expect before and after delivery, early labor symptoms, newborn care, breastfeeding, and so much more. And if you have certain risk factors, you can also get special support to help avoid an early delivery. You'll have access to the Maternity Support Center through your member website. Next slide. It can be hard to fit healthy into your life, but we're here to support you every step of the way. You get a choice of digital coaching programs included with your health plan. All online, all personalized to your health goals, whether you're managing a health risk, overcoming an old habit, or just eating healthier. You choose the goals you want to work on. Here's some of the online coaching programs that we have available. Be tobacco free, manage diabetes, have a healthy back, get heart healthy by managing cholesterol, stress less, weigh less, live well with asthma, eat healthier. Each coaching program is broken up into simple steps so you can reach small victories on your way to the grand prize, which is a healthier you. You'll find realistic recommendations within each program, like adding 15 minutes to your daily walk or not smoking for just one day. You choose the goals and when to work on them. You can even pause, restart, or retake a program, whatever you need to reach your healthier you. Next slide. Sometimes your health questions can't wait until your doctor's visit or even the next morning. With the Informed Health Line, you can speak to a registered nurse about health issues that are on your mind whenever you need them, anytime, 24/7. They can help you save a trip to the ER or make smarter decisions about your health care. You can call as many times as you need. Your covered family members can use it too. Remember to contact your doctor first with any questions or concerns regarding your healthcare needs. Next slide. The Aetna discount program is available to all Aetna members and can help you save money on things like fitness equipment, books, oral health, electric toothbrushes, and so much more. This information can be found on your Aetna member website. Next slide. We want to take the frustration out of healthcare and help you get what you want, when you want it, and how you want it. Here's how we're going to do it. Next slide. Whether you use the Aetna member website or the Aetna Health app, our tools help power your decisions. They can help you find the right care at the right cost and so much more. You can use it for an intuitive search to find and compare in-network doctors. You can have access to your digital ID card whenever you need it. For cost tools, you can compare costs between providers and facilities. Costs reflect your actual health plan. You can view claims, details, track, and pay claims online. For quality and care, you can view and understand plan coverage and benefits. There's also information to help you make more informed decisions about treatment options. Next slide. If you have any questions, here are some great resources for you to help you along your way. Thank you so much for joining, and I hope you have a great rest of your day.